Hey y'all, welcome to my channel. Today we are going to be talking about PCOS. How do I know if I have PCOS? And before you continue, what is PCOS? Okay, what is this abbreviation she's using? So listen up. If you want to find out if you are having issues or if you have PCOS, maybe you're having problems with fertility, your hair is falling out, you're having acne, you're having weight issues, stick around, okay? So, PCOS stands for Polycystic Ovary Syndrome, okay? It is a syndrome that affects women. Hence the name, there's ovary in the name. Only women have ovaries. Now, Polycystic Ovary Syndrome is a combination of different diseases or ailments that come together to make up PCOS. Most women who experience PCOS are having issues with maybe getting pregnant. If they do get pregnant, they're having miscarriages, they're having acne, like maybe severe cystic acne on their face or all over their body, back, thighs, things like that. They are losing hair, alopecia, so maybe they're experiencing a lot of baldness. And some people are having too much hair where they're not supposed to have, like maybe excessive chin hair or hair on your chest, or just, you know, your face is more like, you know, hair here on your arms, things like that. And some people also experience, you know, insulin resistance. That one you probably might have to go to a doctor to find out, but some physical manifestation of insulin resistance is weight gain or diabetes, you know, type 2 diabetes, things like that. Now, the importance of insulin here is because insulin really helps us when we eat, okay? So anytime you eat something, doesn't matter what, your insulin has to be working, because what it does is it takes the food, it breaks the sugar down, and it distributes whatever it is that you ate and sends them to the muscles, the different parts of your body that needs that nutrient. So if it was something like protein, it goes to your muscle. If it was something like fat, it goes to maybe your butt or maybe women breasts, places that you need fat, right? To keep you warm, or just it goes there where it needs to go and get stored for a time where your body might need it. Maybe in starvation or something crazy. But that's just how our body works. That's just how it thinks about things. If it's carbs, it goes to where maybe you need energy, you know, so wherever you're trying to go to run or something where you need energy, those carbs come into effect. So your body, the insulin is doing those things. It's like breaking down your food for you to be able to use it. Now, what happens when your insulin doesn't work or your insulin is broken, right? What happens? We call it insulin resistance. It means your insulin is resistant to working. So that means when you eat, it's not taking the things to where they need to be. It's not taking them to the storage. It's just staying afloat. And so the more you eat, the more it's just piling up. Two things about insulin I want you to be clear about. Number one, insulin supports androgens, like the androgen hormone. Androgen, it's converted to testosterone, which is something that males express the most. When you as a woman are expressing more androgen hormones, it means you're going to start showing signs of more androgen issues. So the excessive hair, the male pattern balding, infertility issues, you know, you're supposed to be getting pregnant, but it's not happening, things like that. So that's why we really need insulin to work. Number two, insulin causes weight gain. If your insulin is not working, it's just piling up, it's just sitting, floating. It means the more you eat, the more it's gonna cause weight gain, because it's not taking those, it's not breaking down the foods to different nutrients and different places where it needs to go. It just stays afloat. It's gonna support weight gain. So the more your insulin is not working, the more weight you're gonna gain. So that's why when ladies come to me and they're talking about, oh, PCOS, oh my goodness, most of them are dealing with weight issues. That's why I really have to kind of go down to the science of why that's happening. It all comes down to insulin. Okay, so if you can understand this thing with the insulin and why it's very important to make sure that your insulin is working, it will save you a whole lot. It's the genesis of everything crazy, right? So those are some of the things that women dealing with PCOS experience. Now for me, I have had my bouts of dealing with some of these things I just mentioned with PCOS. Now, I never even knew the name was PCOS because I never got diagnosed with that, okay? Maybe my case wasn't as severe as some other women, but when you sit and you start looking at all this different, you know, like, hey, that happens to me. I have that too, and that, and that. I'm like, oh, a combination of these is what you call PCOS, Polycystic Ovary Syndrome. And one of the things I also want to mention from the name polycystic ovary, it means there's cyst that sits on your ovaries too. You have a whole bunch of them. Okay, so for that part, you probably will not know until you actually go to your doctor, like your OB-GYN, and they're doing like just regular scans or whatever. I never knew I had cysts on my ovaries until I actually got pregnant and they were scanning, you know, for my baby, and they're like, oh, by the way, you have cysts here, you have fibroids there. I'm like, what? You just are, those are like silent problems that you don't know you even have until it comes a time where you actually need to check. Some people don't show physically. Some people have fibroids and it looks like they're 6 months pregnant. Some people have fibroids and it's smaller than a dime, which was my case. So there are different things that you need to be watching out for. If you think you have PCOS, first go to your physician and make sure, you know, let them give you a diagnosis, put you on meds, whatever it is that you're looking into. But I always try to come from like a more holistic approach on how maybe you could find out why you're having those problems, like the root cause, and then maybe how you can start dealing with it on your own until you figure out a real solution that works for you. You might have to try different things. So for me, it was the acne. I had severe cystic acne, and there's nothing I didn't try. Is it from dermatologists to different people walking up to me and they're like, your face, what are you using? Like, you know, and in my mind, I'm like, are you trying to say it got better? I'm like, but I don't know you, so you wouldn't tell me my face is getting better. So you must mean that it just looks horrible right now, right? And so those are like the rude people that I just wanted to like smack them sometimes, because I'm like, you're so rude. You don't just walk up to a stranger you've never met and start asking about your face. What are you using? You know, like if I told you what I was using, you'd be like, oh yeah, that worked for me. Or like, oh yeah, I'm gonna go home and try right now. Like if you have a recommendation, why don't you just say it? Like you're bold enough to walk up to somebody to talk about your face. What are you using, right? You should be bold enough to be like, hey, I have a recommendation for you, something that you might find helpful for whatever it is you have going on, you know, on your face. But then again, hey, maybe they feel that approach is a better approach. To me, it wasn't. I'm just trying to say all that to say, I know I've been there where you are. So oily skin, severe cystic acne, and then let's talk about fertility. Fertility. Some people can't even get pregnant at all. Some people get pregnant and they have miscarriages. Like I had multiple miscarriages. I have 3 kids now, but before each of them, it was like a baby that was supposed to be. And it was hard because you don't know, for each pregnancy you live in fear and anxiety because you don't know if that baby is gonna make it. And so that's the emotional part of PCOS, and women who are suffering with that issue for me is because I've been there, and it's the fact that you're supposed to be having the most glorious time and the happiest time of your life, but it's hard for you to do that because you're wondering, is this baby going to make it this time? Like every single day you count, you check off the calendar, like, okay, we made it past 1 month, 2 months. Okay, we made it past the first trimester. Maybe we're in green right now. You know, it's just a lot of things that you have to be thinking about, which is not healthy. And also the cysts. Like I said, I had cysts. One of my pregnancies, the cyst actually decided to pop, and I was bleeding. So I was pregnant, and it felt like I was on my period my whole pregnancy, and they couldn't do anything because they were like, oh, you have to give birth, and then after you give birth you have to come back, and then we could see about removing the cyst. But the cyst actually decided to just pop off on its own in the middle of my pregnancy, And so, yeah, that was not a good time. I think with my case in regards to like reproductive health, I've been through it all. And it started at a very early age. I used to have the worst cramps. And I thought that that was what, you know, being a woman was about, suffering in your periods. But then I would see other girls around me and they didn't have issues during their periods. That like they had a normal day, but mine, it was so bad for me. Like I would be throwing up, I would be rolling on the floor with sharp pain, no matter what kind of pain medication I took. Because I guess at some point my body just had built tolerance to over-the-counter pain medications that it just stopped working. Okay, so I suffered through it for like a decade and a half until I figured it out. I figured out how to fix whatever it was I was going through. I figured out how to use functional medicine to heal my body. And I'm only talking about my experience because this is something that's personal to me that I'm trying to help you with. If this is something that you're wondering about, or you know somebody that's also wondering about it as well. But today, my skin is way better. It's not 100% perfect, but I'll take this. I had like my skin, it used to be like pizza skin. Like I used to have bumps all over the place. It was never ever clay. I could never remember like my cheeks, like me rubbing my hands down my cheeks and it was like so smooth. It would be like, boom, 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 boom. I'm laughing now, but it wasn't funny then, right? Even like the scarring used to take like 2-3 years to go off, you know? And so it's just me actively like deciding to take my health to a whole different level, not putting it in the hands of, you know, traditional medicine that would be like, hey, go take this, that, because all it was doing for me was making me depend on that as a solution, and it wasn't for me. Okay. At some point, I also got on hormonal medication like birth controls because of the acne. And they're like, oh, your hormones are not balanced, so let's give this to you. Man, I got off that stuff so fast. After 3 months, I was done. I was like, nah, give me my painful period back. Give me my extra heavy period, because this is not life. Because what happens with birth controls is, yeah, for the moment where you're taking it is just kind of like holding off what your body is normally supposed to do. As soon as you have that break where you're supposed to go off of it, man, it's like, who let the dogs out? Because, man, if I had heavy periods before, when I have those days where I didn't have to take the medication, it was like crazy. I had my heavy period went to like, it was like heavy period times 10. I was bleeding so quickly. I'll have to like be changing like every 40 minutes. If not, I'll be bleeding. Literally, there's one time at work and I was like, you know, working, and I'm like, oh my goodness, I think I'm bleeding out of my pants right now. It was the most embarrassing thing, but it's just to show you the problems that we ladies have. And PCOS, not a lot of people talk about it. It's like a quiet problem. Like you have to even know that that's what it is that you're going through, because I didn't know, like I said, until I figured it out and healed my body by myself. And I went back and I was like, this is what I was going through this whole time. So that's just a little bit about PCOS and my crazy story and experience with it. Like I said, I never saw a doctor because I didn't even know that's what I was going through until I became a certified functional medicine and nutrition practitioner. And I said, I want to do something in women's health, because it was my whole growing up as a girl, you know, as soon as I hit puberty and, you know, menstrual cycle and all that, so I always had issues with it. I didn't live with my mom. My parents were separated. I grew up with my dad. So anything that had to do with like female issues or whatnot, whatever, I really never spoke about it to anybody. And so I just tried to figure out on my own most times. And it really, it really affected me, I'll say. But I'm glad now, especially when I started having daughters, I had to like figure this out by myself, because sometimes this stuff is, it passes down. So if you don't know how to take care of it now, you know, for me, I was thinking, hey, if I don't figure it now, I don't want someone else putting my kids on some kind of antibiotic because of acne or hormonal pills at such a young age because they're saying, oh, your hormones are not balanced, and then it's a whole crazy fiesta. I want to be able to tell them, hey, eat this and that, and don't eat that and this, and your body will be great, which is what I do now. I control what I eat. And not just a diet. I don't like saying I'm on a diet. I don't do diets, but I do know the things that kind of spark my the crazy part of my health. Like I know if I eat this, that, I'll break out severely. If I drink that, things with sugar, whatever, I'll have heavy flow. I can't remember the last time I had to take ibuprofen for my period. Like this, for the last, for this whole year. You know, it's going on a year. It's not even up to a full year where I'm like, oh my goodness, I'm having a lot of pain because of my period. So I think I'm doing something good, and I'm going to keep doing it, and I'm going to keep spreading the word to other women who it might help, or other girls out there, because I started my period at the age of 12, and I didn't figure out this stuff until the age of 34. So how many years is that? That's like 22 years. Okay, this is crazy. So that's really what I want to accomplish with this information. So if y'all have any value that you found in this episode, please go ahead and subscribe, like, and share for anybody that you think might need this information. Until next time, take care. Bye-bye.